So, a warm welcome to everybody for our bi-weekly webinar series. So, every other week we dive into these real-world challenges which are faced by industries worldwide, and we try to bring practical, actionable, and such kind of solutions to the table, which is going to suit well with any business workflow. So today's session is no different. We're tackling issues which directly impact healthcare operations. And trust me, you're going to walk away with insights which are not just informative, but they are really going to be transformative to your industry. And today's session is going to be addressing all these pain points, which are in the hospital management, the bottlenecks that they go through, the daily struggles, the gaps which usually go unnoticed, and how we can solve these with smart technology driven solutions. We're excited to have Yashas with us. He's our experienced senior functional consultant, and he understands hospital workflows inside out. He has a sharp understanding of how technology can really streamline and uplift hospital management. So without further ado, let me hand it over to Yashas. Please take it forward.
Sure. Very good evening, everyone. Whoever is present online and whoever is going to watch later our web series, the webinar series. So, as Arva rightly mentioned, every bi-weekly webinar we concentrate on solving a problem which is available around us. So we have done with hotels, we have done with HRs. Now we have come up with, we have looked into manufacturing, and today's webinar is all about how healthcare can be improvised or digitized, how smart solutions can be found out. So, as the very heading says, we look forward for a solution which can connect all the people, the processes, especially the doctors to the patients. In this, by making the whole process digitized and automated. So, to start with, basically the core idea is about how are we going to make sure the healthcare is going to be automated and most importantly digitized, so that the most important reason for that is basically because 70% of the hospitals under 100 beds, that is, which has 50 to 100 lack coordinated digital systems. Most of them are distributed, most of them are still on registers, most of them are still relying on paperwork and phone calls and emails. Because of which, all these manual tasks and fragmented tools, which are like working in silos, will be causing less in revenue generation or in poor outcomes, poor coordination, very bad experiences for the patients. So what we are looking at as a takeaway with this session is basically it's like a diagnosis for the whole hospital itself. That is a small healthcare unit as well. It includes starting from how do we manage appointments, how do we put out the doctor's appointments, and how are the records of the patients maintained. It could be with respect to blood banks, or it could be labs, or it could be prescriptions, it could be ambulance services. If it has a canteen of its own, and all these aspects put under one roof, is there a one-stop solution that can help us? And basically, we'll try to understand or highlight the problems that are readily available right now, that is, which we can relate to immediately, and what are the possible solutions? How can we digitize these processes? How can we make these solutions more efficient? Is what we are going to look at. So, basically, what we say is the future of any hospital starts with understanding its present. That is, if a hospital has to run smoothly, or a healthcare unit has to run smooth, efficient, with less manual efforts with respect to all the, it could be with respect to having instant decision making with a very informative decision making, to have a solid ground reports of know-how of each and every aspect of each and every process that's happening on a day-to-day basis. So how are we going to move towards that? So let's look into the agenda of the webinar for today. So first is why is healthcare that much important, or what is the impact of healthcare is what we are going to see. Why especially digitization is important. And then we are going to see what are all the operational pain points, probably any healthcare, a generic healthcare, if we look at it, what are the things that they are facing. And then we are going to look into, now we identify a problem. For example, if appointment booking is a chaotic process, they have a phone book record where they have a phone, and then they answer, like, they give out appointments for 50 people in a day, and they maintain everything. That is, they write the names, they write the this thing, and then they'll have to do follow-ups. Then have to make sure this is the time that was allotted. The patient has to be told, again informed, and then the doctor has to be informed. All these things with each and every workflow, how can we make it efficient with respect to workflow as it is, And also, how can we digitize this? Is there a solution to digitize this and make it more efficient? All that will be looked at. And then the most important, what could be that solution? Is there a ready tool available in the market as an ERP tool or a software tool? And finally, we can have a Q&A session where we can, if you have any questions, we can go about it. So let's start. The first thing, as I said, are the statistics and the numbers that we put out. How important is the healthcare? So basically, what we found through a couple of our research things is basically the global healthcare market stands at a whopping $8.77 trillion. That is for last year, ending on March 31st, 2024. The global financial calendars, most of them at least ends in March 31st. So that stands at 8.77 trillion. And we're looking at somewhere it crosses over 10. And in the next 5 years, it will be somewhere around 11 to 12. That's huge. And taking India as an example of a developing nation itself, it stands at by 2025, $638 billion is being put out by, I mean, the total this thing by healthcare itself. And as you know, with our increased different lifestyle, the modern day living, and all our habits and other things, it's estimated that most of our spending, at least whatever we earn, most of it goes back to the healthcare itself. That is, we invest it back or we expense it out in healthcare. And according to WHO, the World Health Organization, by 2026, they estimate that 200,000 more hospitals will be there, but still there are 2.4 million bed shortfalls in India itself. Uh, that's how the numbers, I mean, that's what the number says. That means it's growing fast. We have new diseases, we have new things. I mean, healthcare is now becoming more of a, in many terms, it's more of a growing business as well. But then, as I said, is it digitized? Is it working very efficiently? Are we able to, as a healthcare proprietor or a healthcare owner, am I able to take right decisions at the right moments? That is something that we need to look at. And also, are we able to scale it up as and when we want, or as the business grows, is what something we are going to look at. With, again, constraints like, no, I mean, the budget should not be huge for all this scaling up, and the number of resources, how easy it is to upgrade or get scaled into, is all we are going to look at. So the most important thing for this is basically we are going to propose, or we as Pragmatic, we propose a simple ERP tool to address this issue, that is basically to digitize the healthcare sector. It could be a hospital or a small clinic, or it could be a pharmacy sector or a lab. That is a pathology lab, or even a blood bank, anything as such. So we propose that Odoo as a ERP tool, as a software tool, will help us, and also would be a more efficient tool which will act as a digital nervous system for the entire hospital. Could be connecting all departments, they making, I mean, as I said, to make up a data driven decision in real time. So why Odoo is most importantly, one of the aspect is it has an end-to-end solution, that is starting from maintaining the data of the patients, to the doctors, to all the staff, running payroll for all the hospital, having a canteen facility, having records of, maintaining all the records of patients, purchasing all the items required. I mean, it could be with respect to pharmacy or anything, and maintaining inventory, and finally coming up to all the finance, that is putting up the bills, putting up the advances, insurances, and then finally running up the whole, running the whole business as a hospital. It has all the modules or all the functionalities that is required by a hospital or any healthcare sector. And the other ones are basically the plus points of Odoo is basically it is an open source tool where if at all there is any specific customizations are required, we can do it. Any specific report or any other additional functionality or other aspects which a healthcare unit requires, we can go ahead and use the standard tools, or even we can do this easy customizations. And most importantly, for a simple healthcare unit, we can target an implementation within 90 days, that is 3 months. That is a good thing to start with. Any simple MVP, minimum viable product, we can start with a rapid implementation of 90 days, and then we can scale up later. And most importantly, as I said, we need not go with a big bang approach of, okay, I'm going to digitize my entire hospital on day one. Might not be. We can go step by step. We can take up only few features at first, and then we can scale up. So that modular design of one by one, that is, I'll first get adapted to this digital platform with one module at a time, and then scale it later. I need not have another software for running finance. I need not have another software for running my pharmacy. I need not have another software for running my canteen. So All these things can be integrated in one tool with one at a time. I mean, one feature at a time. And most importantly, as I said, it works across all the these things of hospitals, clinics, specialty centers. It could be pharmacy, it could be veterinary clinic. In fact, it could be we have even solutions put down for even the dermatology clinics, the new beauty clinics that you see, as I said. So all these aspects can be put out in one tool. Continuing further, most important aspect would be also the I was stressing out time and again is the decision making factor. That is, at any point of time, how much inventory do I have? For example, if a blood bank, I need to understand how much of the how many bags of blood do we have? What are the different blood groups? Who are the donors? What information do we have with this? The pathology labs, or all these aspects, or from the finance point of view, how do how is my revenue looking at? What is my how is my P&L looking at? What is all the are all the statutory reports available? Am I able to run all the salaries of the doctors, the nurses, and all the additional staff in my system? So all these things can be made available within one software tool. And because this tool is global, we have multilingual and multi-location support. It works across the globe, and even within India, it works across all states. And then, most important aspect is, with digitization, we mean less of manual efforts, that people don't have to sit and do the bookkeeping work, but rather they do. I mean, as and when they do the physical job, they just continue to do the same in a system as well, so that it keeps adding up the data, and it gives them better decision making aspects. So that's one of the most important thing which I highlighted again. We don't need 10 different systems to run a hospital. Rather, we can depend on one such tool which will do the job for us, where it is adaptive, where it is smart, which will help us take decisions with right information and right data. So that's Odoo for us. So let's look into how and what are the challenges first with each and every. Probably, I mean, we have put out certain segments of the healthcare unit. What are the challenges with each of these sectors, and then how with Odoo we can achieve the results? That is, how Odoo can help us digitize this, automate it in places, and how it can make a healthcare unit, particular any proprietor of a healthcare unit, take better decisions in place. So let's look at one by one. So to start with, let's start with the appointment and patient flow management. Usually, as I said earlier as well, smaller hospitals or smaller this thing clinics still doesn't have the digitized format. They do everything. I mean, especially in developing nations, most of them will be completely relied on a person who is going to attend the call, and they're going to get the booking done. That has to be then informed to the doctor as well, and then probably we might have to even follow up with the patients as well for the time and whether they are going to be present, what all things they need to carry, and all these things. So it's pretty much of a chaos every day. But what if the flow can be put out in such a way that the patient calls, certain times even VoIP calls can be recorded, or we can even put out a smart quick form through Odoo itself, and we can say, okay, please do fill this up so that your appointment can be visible through appointments module, and all the other stuff. So the patient gets to know, okay, this is the hospital website. I get to there. I want to take up with different departments. Is the doctor available for the specific date? And if yes, what slot do I book? That can happen digitally. And then once that is done, once they book a confirmation, they might end up paying then and there itself, or they can pay later also. Can provide both the options. Once that is done, an appointment is confirmed. Uh, Confirmation should be sent either via SMS or email or WhatsApp with the recent updates, so that the patient is very well informed. And then we can even do follow-ups, because if there is a chance where patient might even forget, probably if the appointment is 2 weeks down the line or 3 weeks down the line. So there can be regular follow-up reminders from the system, and then they visit the hospital or the doctor. All the documents that they put out, they can even attach few soft copies if they have, or even the prescriptions can be put out over there. And finally, the billing happens. Imagine all this in a digital software, that is a digitized way, where everything, at least most of these parts, starting from confirmation of the appointment to the follow-ups to the billing, if it happens in a system, how well it is. And this can be accessed by the patient as well. So that's what we are looking at. So basically, we're using Odoo's modules of appointment. We can schedule we can list down the doctors available, their availability, and the slots, and where the patient can book it. And then the auto reminders via SMS and email. and then the complete flow, that is appointment to invoice generation in one click. That is basically they get to know this is the appointment confirm. It gets confirmed. Then once the doctor attends them, it can go for the immediate billing as well. And it can also be put out like, is it an outpatient department or it comes to an inpatient this thing, that is they have to admit them or something like that. So here is a quick a screenshot which depicts where we have mapped these things in Odoo, where it can you can clearly see the appointment ID is there, who is the patient, the urgency level, when is the appointment this thing date, for how much number of hours, or it could be like 20 minutes or half an hour or something like that, which healthcare center it is, whether the patient what is the status of the patient, is it ambulatory or they have to get admitted, basically, and what status is it right now, who is the physician, and all these things. Imagine this be available even with the customer and along with the healthcare unit. So it will be more easy to have the whole flow, the data flow, and the doctors can also take informed decisions. Next time when the patient repeats, they can simply go through the history and they can say that, okay, these are the things that were already prescribed, or these were the medical records, and this is how we take it further. So that's where we say it can be digitized. Now let's look into a new one, where the inpatient and ICU management, where basically most of when the problem is a little severe, or when there is something which needs to be addressed by having a patient admitted into hospital, there will be registration, then they'll be allocated with a particular wards, and then they'll be allocated with the doctors. There can be, if there is anything serious, they might even require the ICUs, where the bed changes or movement from the ward, upgradation from ward to ICU or the other way around. Most of these things happen manually. Most of this will be recorded in registers. What if the flow can be streamlined? What if it's where we can put out the moment admissions are logged, the moment a patient gets admitted into the hospital, right from there, if it's the first time, they can put out all these things. The healthcare unit people who are in the receptions, in the front desk, can record all these things in the system, and then depending on the severity, the beds can be assigned, and then who's going to take care, what type of care they need, which department, which segment of the healthcare unit has to attend them. Is it physiotherapy, is it cardiac, is it orthopedics, or is it basically ENT, so that can also be looked into, and what type of ICU is required, because there are different types of ICU. There is NICU, there is regular ICU, there is MICU. So which ICU has to be allocated, and if there is any transfer between one department to another department, how is that going to happen? And finally, with all these things done, with a good diagnosis, with a good patient handling, finally the discharge and the billing. So if this can be coordinated and digitized in the system, that would be more advantageous, where less of paperwork, more of quick information. This patient requires a transfer, this patient requires change of department, new doctor needs to take care of, and all these things can be taken up much faster and much efficiently than happening it in a manual way. So again, we are going to look at, as I said, the real-time bed tracking and availability, and most importantly, if there has to be a change of departments. Now, for example, a cardiology was looking into a patient, and also they might also require ENT, or they might also require orthopedics. So the situations are completely dynamic in nature. So if this can be put out in digital formats, better decisions can be taken. We can seek the doctor's availability and their these things. Their availability, and also their the way. What are the diagnoses that has to be put out? What is their history, and everything can be tracked in the system. And most importantly, the ICU lifestyle. That is, what is the history? Since how many days they were there? What are the prescriptions that they took? The number of doctors that they visited? So all these things again we have put out in the system itself, where you can see the hospitalization administration screenshot over here, where it says what is the registration number, that is when the patient gets admitted, a unique number can be generated with the patient number, with the doctors, that is the physician's details, and basically what is the reason for admission, and then what is the type of admission, when did they get admitted, and is there any transfer history from one ICU to another, or one bed to another. All these things can be tracked over here. So as we put out over here, because it is healthcare, it is very critical, and every handover is a risk point. Most importantly, digitizing these operations and streamlining these operations makes it, it turns out risk into reliability. That's the most important thing that we are stressing out. Next one would be, as I said, continuing further, would be the patient history and prescription management. Right now, especially with growing with age, the number of hospital visits with our modern lifestyle will increase, and number of prescriptions might increase, and we definitely will lose track of records, what was prescribed or what medications were we taking. Could be anything. I mean, we might change because of, how healthcare works, and most importantly, it's also to do with the psychology of the patient. So we might change the doctors when we don't find the results for ourselves because of our own reasons as well. So uh, we also don't have the records. Even the healthcare unit sometimes struggles to keep up these records. So what if we can have, these are the challenges, but what if we can have, when the patient gets registered in a healthcare unit, all the history is captured. It could be with their personal information, that is healthcare information. What could be their blood group? Is there any history of any illness or ailments or any other prescription that they were taking? And then a doctor's diagnose, I mean, a physician diagnoses the patient's create, which is again recorded, which is then directly synced with the pharmacy. If we have an in-house pharmacy of a healthcare unit, we can directly sync over there, which where they can see, okay, this is the prescription that the doctor has given, and these are the things that we need to issue based on the customer's requirement. And finally, an invoice also will be generated. So again, we are speaking about digitizing these processes in such a way that all the things are streamlined, and most of the processes are available in real time in digital formats, rather than looking into physical copies of prescriptions, maintaining huge files and losing them altogether, and then getting lost of all the details that happened in prior. So electronic medical record is what we say, with lifestyle, allergies, and chronic disease tagging, where we say the complete history from our birth to so far our presence. We can maintain it in the system itself. And then what are the different types of prescriptions and validations with alerts? If they, I mean, for example, if the doctors have prescribed, the customer can have their own like module, or in such a way that you have to buy this particular this thing, that is medications, or you might have to go for another vaccine, or all these things can be put out with alerts and exceptions in the system itself. And most importantly, as I said, again, taking up a printout, going to the pharmacy, and then taking over there and they generating another invoice. Rather, we can streamline it in such a way that if the patient wants to choose the pharmacy in house of the same healthcare unit, that can be put out in such a way that they can have the, I mean, the pharmacy can have this particular prescription digitally available, and the patient can choose from it. So you can see another screenshot over here where what is the blood type, what is the family, these things, and then what is the, is there insurance covered, or ethnic group, address, and all these things put out. Diseases, I mean, if there are any pre ailments, what are the medications taken, what are the previous appointments that they had put out, are there any genetic risks, lab tests, history of lab tests, lifestyle, what could, I mean, could be their food aspects, or it could be allergic aspects, and all these things can be put out over here. If they had any surgeries or any other aspects, can be recorded over here. Again, Odoo can help by recording all these things. That's where we want to pitch in. I mean, we want to connect the healthcare unit along with the ERP tool that is available, so that all these regular workflows of a healthcare unit is already covered in the system. So question would definitely be asked is, we consider money very, very important. So with all these history and other things, would you trust a bank that forgets your history of what transactions you did? Definitely not, right? So how can we trust the same with our healthcare unit? So we have to make sure these are available, and these are the ready, I mean, these are the solutions that should be available with our healthcare sectors as well. Going further, as I said, we spoke about pharmacy. Let's get into the actual problem of that, especially labs and pharmacies put together. So right now there will be, I mean, there are certain healthcare units with its own lab, pathology lab, and also pharmacy units. And again, most of them are not linked. Right now, it is not integrated. They will have a separate lab. The doctor has to write a separate prescription. They give it to the lab. Then they do all the reports. Again, we have to go and collect a physical copy of it. Again, give it back to the doctors for the diagnosis. But what if this whole process can be digitized in such a way that the moment I have a appointment, if at all there needs to be I mean, laboratory test that I need to undergo, the doctor prescribes it, and that goes straight away to the pathology lab, and I don't need to carry a appointment, or I need to take a printout what test it is or anything as such. And then they check it, and they do the testing, and they update the records then and there itself with the results, so that I get to know that, I mean, basically what are the samples collected, and they get to know the result, and it's logged in there itself, so that the doctor can also access it and later take it up for further prescription. And that is one. Coming to the prescription again, once the doctor prescribes me, that goes straight away to the pharmacy. They check the stock. They, based on my requirement as a patient, they issue the stock for me, and then they issue the bill. So all this put together with one patient can be put out together. That is, the lab need not give me another one invoice separate. The pharmacy need not give me a separate invoice, and the doctor need not give me a separate invoice. Everything can be put out into one patient record and can be an integrated solution. Uh, as I said, starting from lab request tracking to alerts, if at all there is something goes abnormal with my results, so that has to be also put out as a alert and notification. And then for the pharmacy people, they can clearly have an inventory module itself, where they purchase the all the purchase all the materials that they require. They issue the goods to all the, they sell all the medication, and it could be various things to the hospital or also to the patients. As I said, you can see the records over here. A couple of screenshots. What are the lab tests where we can have certain lab tests put out in Odoo itself? That is the blood count and who is the patient name, who is the physician, what are the different things that they see. That is, you can see the hemoglobin, RBC, MCH, MCHC, and other medical terms put out over there. I'm sorry. So, and the results put out recorded in Odoo itself. And then what is exactly required? For example, for that is, if at all they take X-ray scans or if they do MRI scans, what is the result? They want to put out images as well. The records that you see, the records that you maintain physically, can be attached in Odoo itself. As a PDF or as an image or as a Word document, anything can happen, and so that it stays as a record digitally as well. So basically what happens, as I say, we feel that when diagnostics and drugs are disconnected, the patient's care gets compromised. That is, we feel that because of this disconnected workflow, the patient has to run between the departments or run from one aspect to another aspect, maintaining all the records, with already so much of things going on with their own health, which is more of concern. Maintaining these documents, putting up the bills, putting up the registrations, getting to go to each and every department makes their psychological workload increasing. So that is where we want to address, so that these things can be digitized and make it even more efficient, both for the patient and for the healthcare sector. Proceeding ahead is the health ambulance and emergency services. What could be the problem over here? One is, how do I know how many ambulances are available right now? Is there anything? How many ambulances are available? Are there anything in already have gone to pick up the patients, or anywhere to drop the patients? Or the most importantly is the coordination and tracking, which lacks. So what if we can have, if there is a call made to the emergency, they put out an ambulance, they get to know, okay, these are the ambulances available, I'm going to assign it immediately. They assign it for a particular patient, and then the tracking happens with, the GPS tracking can happen for the healthcare sector, and also for the healthcare unit, and also for the patient as well. And then they arrive at the hospital, and then the patient admission happens, which will again trigger the inpatient or the ICU and other things, which we have already mentioned. So this is the process, and we feel that this can happen in Odoo as well. As I said, you can see over here with one of our screenshots, which was taken from Odoo, where we have put out the features, where what are the ambulance numbers, and what different types of model is it available, is it in service or available or under maintenance. I can have an immediate quick through, immediate, I can take immediate decisions based on the log available in the Odoo itself, rather than depending on manual or physical calls. I have to call someone, or I have to get to know whether the vehicle is available or not. So as a very important thing, in emergencies, coordination isn't a luxury, it is a lifeline. So this digitization and coordination is what any healthcare unit is definitely need to be equipped with, and that's what we are also aiming for, to put out these solutions. Then going ahead with other sectors of the healthcare unit is the blood bank management. The challenges right now would be, at an emergency time, the stocks of the things will be maintained either in Excel, or they'll have physical records. And they have, it's going to be a very tedious task to basically track the inventory, who are who are the donors or other things, and how is, they'll have to keep a record of how well is this maintained, and what is my actual inventory looking at. So what we feel is, basically, if there is any blood bank request, that has to be digitally put out in the system, and when we finally find a donor match, and we record those details also, and we record the donations as well, and then that gets updated as our stock. That is, the physical inventory goes up. And our request gets fulfilled. That is, we issue it later when there is a crisis occurs. There is a, blood request put out by an ICU or any other emergency services. We issue for that. But for that, we need to know how many different types of blood groups we have, how much of blood bags do we have, the standard bags or the regular ones. So that information right now, we believe, is most, in most small and medium scale healthcare units are manual, and we propose to make it digitalized. How do we do it? As I said, we can have a central blood inventory management within Odoo itself, and then which also tracks it with the donors. That is, as an internal healthcare unit, we get to know who has donated this particular bag with the specific serial number, their blood group, and all the details. And then once there is a, basically, if there is a this thing, that is, when there is a stock, when we have to issue, we'll clearly get to know that, okay, whom we are issuing it, who is the patient that we are issuing it. And also, as and when we issue it, the stocks goes low. So auto alerts will be there in place, and also expiry will be there in place, which says that, okay, you have low stock levels, please do create, please do conduct probably blood donation campaign, or ask more patients to fill in the liquidated stock. So that can also be done. So as you can see on the screen, again, we can have that, who are the donors, what are their different blood groups, what are the age, what is their weight, what is the height, and then all the details can be recorded. And once the blood is collected from them, that is, once they donated, the stocks can also be updated. That is, basically, in Odoo, we can have a multi-hospital setup as well. A single holding company can run multiple units of hospitals, and that can also be put out. That is configured in Odoo, and you can have multiple blood banks of your own, and that can also be put out in Odoo as well. So at any point of time, real time visibility will be available. So as I said, when life depends on blood availability, the system also must be as responsive as the team itself. So rather than depending on manual task coordination on phone or something like that, these things should be digitized in such a way that the decisions are taken quick and also efficient. That's the most important aspect. Continuing further are the other attached sections for the healthcare. That is, most importantly, canteen management. It could be for patients, or it could be for internal food management, also food and beverages. So most importantly, the chaos, because the whole healthcare unit will be having one or two canteens, and they'll be filled with or flooded with people. So the chaos in the orders, the billing delays, the food wastage, and most importantly, most of the canteens do not even will not be even aware of how much inventory that they have, so that they can maintain the whole the process. So what we put out is, what we propose is, basically, even the canteens can be digitalized in such a way that the orders can be put out in Odoo itself, and then the product availability can be checked. How much do we have? What do we need to produce for tomorrow? What all plans? What all meal plans that we can put out? And as and when we put out the orders, we generate. We hand over the food, and then we put out the invoices also, with the payment immediately being received through any online or cash payments, and then we can issue the tokens and orders can be delivered. So these details can be put out in Odoo as well. Along with that, we can also make sure all the purchases and also the stock keeping can be put out in Odoo itself. That is, again, the inventory model comes into place, the accounting model comes into place, the purchase model comes into place. So the standard Odoo itself will cater to all these requirements. As I said, you can see one of the screenshot for the canteen order, where it says a very good South Indian food being given to one of the patient. One of the customer who is also a patient, where the token numbers are put out, the deliveries, and then whether the delivery is completed, what is the canteen ID, and what is the food that has been ordered with the amount and everything. Over here, you can clearly note that the invoicing and also the payments all are integrated in the system itself, so that you don't have to worry about taking a print or issuing a token and all these aspects. So that's what we say. Even food services in the hospital deserve precision, because every patient meal matters. That is, what are we giving for the ICU patients, whether it is at cost or whether it is charged for the patient. All these things can be tracked within Odoo. Going further, a couple of other aspects, the childcare and the surgeries. So what are the challenges over here? Right now, the most important thing is the tracking of the whole aspect. That is, specialized tracking for newborns and surgery events, and also the manual billing gaps, which you saw earlier as well. What we propose is, basically, when there is especially in the pediatric department, when there is a newborn child there is a birth of a newborn. So we start the tracking mechanism over there, so right from there. along with the mother's details. We put out the newborn's details. We put out, I mean, because there will be a lot of tests, there will be a lot of procedures that has to be done. The checklists have to be prepared, and then we, with each and every test, we also update the records, and we keep maintaining the whole this thing, that is the progress of the child. That is, they might continue with the same hospital, so that the complete record is available with us, starting from its birth to so far whatever the test that has been done, the vaccines that has been provided, and all these aspects. And then for the surgeries, we can also put out in such a way that if a surgery has to be put out, it could be for a regular patient, or even could be for infants or any child for that matter. So the surgeries can be put out in the appointment module. Basically, who is a surgeon, and basically when it has to be done, for how much time it has to be done, and then what are the checklist for any particular surgery. That is, we need blood banks. I mean, it requires so much of blood to be replaced, or other tools to be put out, other equipments, and also the medications. All these things can be put out over there, kept ready. And most importantly, once the surgery takes place, the post-op notes, that is what all happened, the doctor writes a very detailed report, and that can be made available in the digitized format in the system itself. And finally, that goes for the billing. All these things again can be done within a tool itself, which is Odoo. So as I said, all the tracking system of the surgery, from the scheduling to the outcome, and overall can be put out in such a way that it's going to be a one-click invoicing system. Either could be for pediatric, also for the this thing, that is basically for surgeries. You can see one dashboard over here where we have put out for childcare. This is again a newborn info, where who is the mother, what's the newborn ID. I mean, we provide an ID for it. We can give a name for it, and all the details of its I mean, the hospital details, or most importantly, the healthcare details can be put out over here, which any pediatrician will record. And then we can continue this so that it becomes a digitized record and available for any time. That is basically analysis and for diagnosis. So, as I said, because the child, I mean, the newborns and the children are taken care with utmost care, their details also needs more important. I mean, the important care and precision. So, because of which we feel, rather than having manual records and maintaining everything manually, it's better to have all these digitalized in such a way that it is available for any time record keeping purposes, and for I mean, as I said, taking informed decisions at any point of time for the physicians. Most importantly, coming to the last section of it, yes, we are speaking about all these aspects of healthcare. How is it available with like a dashboard, or with respect to reports? And even one of the most important aspect is with respect to bed transfers. So how is this available? Is there a solution right now? Because what we feel is, with each and every department, everybody works in silos, and the data is fragmented. There is lack of visibility between one department to another. For example, if I say blood bank to pharmacy to the orthopedic department, there is, all of them are working together, but with manual coordination. So that is where we say the lack of visibility and the fragmentation of data is currently being practiced. But what we propose is, especially for the bed transfers, if a particular patient requests a bed, that can be put out in the system, where they can get to know, okay, whether how many beds are available, based on, I mean, they can filter it based on the requirement of the particular patient, and then it can be assigned, and the history also can be logged if there are any transfers. And also, all this will be available as a report. As I said, the dashboard showing live KPIs, the bedmaster with history, and all the transfer logs. So you can see over here, for a particular clinic, this kind of a dashboard would be very, very helpful. So far, 34 appointments are there. Today's appointments will be zero, probably on a holiday. This thing. So far, admitted patients are 35. Then there are emergency cases 22, and free beds are 4. I can only accommodate 4 until unless there are no discharges. There are blood requests of 41, and so much of stock is there available with us. Number of surgery cases, total lab requests, ambulatory requests, and basically available ambulances, and then the total revenue. So if this kind of a coordinated and accumulated data is available to a healthcare unit, we believe that the healthcare sectors can grow, and most importantly, scale better, and above all, give very good services to any particular patient. So as I said, and coming finally, everything ends up into, as I said, into the invoices, the numbers, the financial numbers. That is, we can build all these operations based on a different, I mean, that is basically each and every department of the healthcare unit works in its own process. We can build all those things, even if it is not available in the system. But finally, everything ends up into are we generating good revenue? Are we making money? Are we making what are my expenses? Where am I spending more? Which department is spending more? Which is more uh, which department is doing good? Which department lacks the this thing? So all these aspects can be checked out with respect to insurances, with respect to payments, with respect to billing delays. All these things can be put out with the with the software itself. So as I said, any of the services delivered, any of the charges captured, we can check if the insurances are available, and then invoices can be generated. Payment again, payments can be put out as an advance, or it can be also after the service is issued, and then there can be receipts issued. It can be a proper tax invoice generated from the system itself, and if it's a B2B, we can even go with the e-invoicing as well. So all these aspects digitized way. How Odoo simplifies it is basically it acts as a central billing hub. You have all the departments, but finally it ends up in one billing center. That is a centralized billing center where everything will be part for the under the one company. It could be pharmacy bill, it could be lab bill, it could be canteen. Everything ends up into our standard chart of accounts, and everything will be put out for a accountant. Everything is available in one place rather than having collecting P&L for from canteen, P&L from pharmacy, P&L from OPD and other aspects. Everything is put out at a company level, that is at a healthcare unit level. And then invoice generations can be made automated, patient wise or company wise we can make it, and it's very instant. And also the payments can be tracked, and the payments can even be made online. That is basically we can make use of card, cash, UPI and all these aspects. And most importantly, the information goes digitized to the customer as well, that is the patient as well. It could be over email, or it could be with WhatsApp or SMS, and all these aspects. Because healthcare sector has a lot to do with insurances as well, because nobody anticipates these kind of things, and because of which uh, we as people buy insurances so that we are safe. We cannot anticipate it. If something comes up and we have to spend too much, we might not have cash, or we might not have the money. So keeping a track of insurances, how much is spending with us, how much is the healthcare right now requires it, all these things can be integrated within the software tool itself. And also, as I said, the question that might ask, okay, now I have a system, I have all these processes, can it be driven based on access? That is, the pediatrician department need not know what the canteen does, the canteen department need not know what the blood bank does. So yes, it is a tool which has access driven roles, with each and every process put out into one single software, but finally integrated with respect to all the physical processes. So no more missed charges, no more delayed bills. It's just clean, compliant, and complete revenue cycles. And one of the most important thing is this particular tool, Odoo, is with respect to, I mean, it stands compliant with all the statutory requirements. That is, all the reports, especially the financial reports of P&L, balance sheet, inventory valuations, everything will be available within the system itself, so that it stays compliant with all the statutory purposes. So with this, what we say here is a tool to address the problems of the healthcare unit, and here are the certain processes that we propose as solutions. So this is the end of the webinar, and if you have any questions, please do feel free to ask. If you have any problems that you might feel that yes, can there be a solution, or is there a solution for this, you can, or if even if you have suggestions, uh, please do feel free to share with us. Thank you.